Madam President, on a separate topic, tomorrow night, members of Congress and their guests will gather on the floor of the House to hear the President on the status of our nation. This annual address traces its roots back to founding fathers, but I doubt that they would even recognize their beloved country today. With President Trump and Elon Musk acting unrestrained, we are barreling down a dangerous path to a constitutional crisis. In the Judiciary Committee, which you serve on, we had 3 witnesses last week, nominees to serve in important positions in the Department of Justice. The question that was asked of them was very basic. Would you advise a public official in the United States of America to follow a court order? Just that simple, to follow a court order. And they hemmed and they hawed and they said generally so, generally this. The most lucid statement was made by a Republican Senator, John Kennedy of Louisiana, who said the answer is yes. You either follow a court order or you resign your office. It is that basic. But if you listen to those 3 witnesses, there's a serious question whether that would happen. It's a question as to whether or not there is any check or balance on the executive branch if they will not live by the findings of a court. It troubles me. It continues to trouble me. And it's at the heart of our concern about the future of our Constitution. Madam President, I'm going to have a guest at the State of the Union address tomorrow night, Dr. Elizabeth Sokol. She's from Lurie Children's Hospital in Chicago. I know that hospital well. My daughter was treated there for years. I think it's one of the best on God's green earth. For more than a decade, Dr. Sokol has been a pediatric oncologist at Lurie Children's in Chicago. She treats young children with neuroblastoma, the leading cause of cancer death for children age 1 to 5. Dr. Sokol's work, which includes conducting clinical trials on neuroblastoma brain cancer research, is funded by the National Institutes of Health. The NIH is quite simply the premier medical research agency in the world. It provides over $38 billion in research funding to all 50 states, including yours and mine, studying everything from pediatric cancer to dementia, Alzheimer's, ALS, diabetes care, and heart disease. Breakthrough research supported by the NIH has made a difference. You know all those ads you see on television about those drugs? You can hardly pronounce their names or remember them. People skipping through a field of flowers, feeling better because they take a certain drug. 99% of all the new drugs in the United States, all of them, 99%, started in research at the National Institutes of Health. If they're good and they're important, you can credit taxpayers for creating an agency that does the research. That breakthrough research has made a difference in the lives of thousands of people. Yet this is one of the agencies, the National Institutes of Health, that President Trump is dismantling through a series of abrupt, illegal, devastating funding cuts, gag orders, and mass firings. As a result of President Trump's actions, Dr. Sokol's work on neuroblastoma in kids, brain cancer in kids, and the lives of the kids who depend on it is in serious danger. Rather than empty rhetoric, Dr. Sokol actually does the work to make America great, offering families hope. You don't think that these families think it's great if she can find something to cure their child? Donald Trump and Elon Musk are trying to stop her. That sounds like a rash political statement, but it's true. At the same time, Dr. Sokol's hospital, Lurie's Children, is staring down massive cuts to Medicaid for life-saving treatment of critically ill children. Medicaid is the lifeline for Children's Hospital. If we go through with the planned budget we hear from the House, the cutbacks of 14.5% in Medicaid funding will dramatically hit American hospitals. Rural hospitals will close, children's hospitals will close, programs will be shut down. Medicaid is their lifeline. It covers nearly half the kids in this country. If you slash Medicaid funding for Lurie Children's in Chicago, Cincinnati Children's in Ohio, Children's Hospital, Pennsylvania, you are harming life-saving treatment for kids with cancer and other serious conditions. For as long as I can stand and speak, I'll be standing and speaking in support of NIH funding and the work of people like Dr. Sokol. She's my guest tomorrow night because I want my colleagues, when we sit down together for a light dinner before the address, to meet this NIH researcher and hear from her firsthand what the cuts of Elon Musk and Donald Trump are doing to children's research in America. Surely we are better than that.